Good afternoon and welcome to the 12th installment of the Alliance's COVID-19 webinar series, Making Housing Happen in Difficult Times. I'm Mindy Mitchell, a Senior Technical Assistant Specialist here at the National Alliance to End Homelessness. And joining us today for this important webinar are Mia Bryant, from the Capacity Building and Equity Program Manager at the Connecticut Coalition to End Homelessness. We have Jamie Hummer, Program Director, and Jennifer Steigerwald, Coordinated Entry Specialist at Strategies to End Homelessness. And we're also really lucky to have Becky DeBelt from Strategies, who will be joining us during the Q&A section. And finally, Sarah Busick, our Path Home Program Director at Catch in Boise, Idaho. So I have just a few housekeeping items before we get started. This webinar is being recorded, and all registrants for the webinar will receive an email with an accompanying link to the recording, the slides, and additional resources within 24 hours of the broadcast. All of the attendees are on mute and will remain so throughout the broadcast, and all video functions have been turned off for attendees. Additionally, the Zoom chat function has been disabled, but if you have questions, please enter them into the Zoom Q&A box that should be along the little ribbon at the bottom of your screen. We will be holding questions until after all presentations are complete, and then there will be time for a Q&A in which all the panelists will participate. Any questions that we don't get to in that time will be gathered by Alliance staff and will be included on our Ending Homelessness Forum, which I'll talk about some more in just a minute. The Alliance will continue its COVID-19 webinar series throughout the month of May, and you can access those resources and sign up for future webinars on the Alliance's webinar series page, the URL that you see here. If you haven't already, please do sign up for the Ending Homelessness Forum. That's forum.endhomelessness.org/login. This is a place where folks can obtain information on federal funding and guidance on the COVID-19 homeless response. You can also share information there about what you're struggling with, successes, emerging promising practices, and pose questions to one another on how to face the common challenges that communities and programs are dealing with during this pandemic. Finally, I also wanted to share with you all a really big announcement. The Alliance and the National Healthcare for the Homeless Council are launching 7 courses to support staff who are working with people experiencing homelessness in hotel motel settings and in congregate shelters. These courses are meant to assist in onboarding staff and new hires in the COVID-19 response. Healthcare professionals working with people experiencing homelessness for the first time, and shelter staff will benefit from these courses. It's important to note for all of us on today's webinar that these will be a good foundation for moving forward and becoming housing focused shelters during the COVID-19 response. So through a generous grant from Kaiser Permanente National Community Benefit Fund at the East Bay Community Foundation, the Alliance, the National Healthcare for the Homeless Council, will be offering these courses for free for up to 2,500 users. So please visit our website at endhomelessness.org/COVID learning to enroll. Finally, one more thing to make you aware of before we get on to the important content today. National partners have created something that everyone should work on using as a resource in communities. It's called a Framework for COVID-19 Homelessness Response, and it provides guidance for how homelessness systems can leverage CARES Act funding and other funding sources such as FEMA public assistance to simultaneously conduct emergency protective measures while also planning for the recovery-oriented use of these funds. The purpose of the framework is to provide guidance on how communities can use funds strategically across a range of key public health and economic recovery strategies, to help communities meet public health goals, to increase housing stability, to prevent future increases in homelessness that will result from an economic downturn during the pandemic, and to ensure that all components of the framework include a racial justice and equity lens. Of course, these are just a few of the actions that you can see here that are in the framework, and you'll click on the link when you get the slides after today's webinar to be able to explore more of the recommended actions. All of the actions will need to be coordinated across many partners and systems across all levels of government, including emergency management offices and emergency operations, cash assistance programs, public health, physical health, behavioral health care services, and homelessness services and housing. We will constantly update the framework with information on strategies, protocols, funding sources, implementation tools, and other resources as they emerge. You can access the framework on the Alliance's website that will be available on the slides when you get them after the webinar. And we're going to go ahead and get started today with Mia Bryant from Connecticut Coalition to End Homelessness. So Mia, I'll just ask you to turn on your video and unmute yourself.
Thank you, Mindy.
Welcome. And just let me know when you want me to forward slides.
Okay, sounds good. Thank you. So I'll start off with my first slide. So hi, everyone. As Mindy said, my name is Mia Bryant, and I'm the Capacity Building and Equity Program Manager at Connecticut Coalition to End Homelessness. If you're not familiar with CCEH, we are a backbone organization in Connecticut's homeless response system. We have several work areas, which include training and TA, state level advocacy, emergency assistance, and we also manage our state's HMIS, or Homeless Management Information System. So before, the slide is good. So before COVID-19, we were definitely focusing on being low barrier and having housing focused shelters. We worked with NAEH, Mosher exhibit specifically to have learning collaboratives. So far we've had 2, and right now we're actively involved in one of our counties. And they've been super helpful with helping us to make shelters who are part of that collaborative become low barrier. Now, most if not all of our shelters are wet shelters, which means that people can enter the shelter even if they are under the influence. And there are some safety protocols in place to make sure that the staff and shelter guests are safe. Changing rules, expectations. There were some shelters who had pages and pages and pages of rules, and were able to reduce those to just a few pages of expectations and really make their interactions in their environment, their conversations, housing focused by putting up bulletin boards and resource boards, and changing their shelter meetings that they would have with all the guests to really focusing on housing instead of, little issues that were arising between rooms and so on and so forth. And so it has been super helpful. Also, something that we have focusing on system collaboration. So not just having shelters exist in their own silos or rapid rehousing exist in their own silos, but really helping providers to connect and work with each other to not only share resources, but to help move a person along throughout the system if they did need to access rapid rehousing after shelter. How can case managers in the shelter provide a warm handoff to rapid rehousing? And that's just one type of example. So on the next slide, another thing that we were doing pre-COVID was really trying to focus on race equity. How could we really transform our system to be racially equitable, recognizing that there are racial disparities in inflow, but could also be some racial disparities in people who are currently in our system, program outcomes, access to resources, so on and so forth. So that starts with recognizing that racial disparities exist, analyzing our data for racial disparities, and that's an ongoing thing that we have been doing. Also, we worked with Connecticut's CCEH to develop a race equity framework, which was a statewide effort with a number of providers from different organizations. And also working with Chandra Crawford on the Connecticut Racial Equity Network, or working on the Racial Equity Network that's national. And within Connecticut, we decided to pull together Connecticut providers who are working in housing and home. We're implementing racially equitable programs and strategies to form a Connecticut REN. So that's not official, but we wanted to be sure that when we were working with Chandra on the national racial equity network, that we were presenting ourselves as a unified group. And so also training, doing a number of trainings, and within CCEH, our organization, just diversifying our board and being very intentional in our hiring so that we could have a diverse group of people who are working to end homelessness. So on the next slide, there have been a number of racial disparities that have been highlighted during COVID. And so in Connecticut, for example, African Americans account for over 30% of people experiencing homelessness, but only 10% of Connecticut's general population. And this information comes from the census as well as HMIS. Within COVID, we are seeing now dashboard on ctdata.org that shows that Black African Americans account for around 20% of Connecticut positive cases and around 15% of COVID-related deaths. So with that, we are paying attention to who is currently in the system, the inflows, and as well as being able to track COVID. Today, we did a webinar where we just released new fields in HMIS that will allow Connecticut providers to enter information about testing, whether people in the system are being tested, their symptoms, and being able to track that. So we could really pay attention to what the needs are and if there are any disparities that exist. There has been so much information coming out in the news about racial disparities in COVID. So we really want to take this opportunity to bring this issue to the forefront and make sure that we are not perpetuating any type of racial disparities, specifically during COVID, but in general as we work to end homelessness. Next slide.
Hey, Mia, just want to let you know, sometimes your sound is kind of like cutting in and out. It's only for maybe like a syllable here and a syllable there, but it is kind of cutting in and out.
Okay, thank you. I'll try to be clear, speak up. Okay, thank you. And so Connecticut shelters have undergone a shelter decompression effort, which in Connecticut looks like the expansion of the system to include hotels and motels. So this allows greater opportunity for shelters to provide quarantine space, isolation space, and just general social distancing. However, with that, our governor's order only goes until June 1st. We only will have the hotels until June 1st. And so we are really working on vamping up our housing efforts in several different ways, just really getting creative and collaborative, because we know that shelter and hotels are just permanent options. They're just there to meet an urgent need, but are not housing. And so we really need to be able to move people to housing, especially before that June 1st deadline. And part of the barrier that exists there is that some people were currently in shelters and moved to hotels, but there were some people who were experiencing street homelessness and were unsheltered and entered the hotels. And so we definitely do not want to recompress the shelters. We want to ensure that we are doing our due diligence to really help as many people as possible move to permanent housing. And on the next slide, the way that we're doing this is part of it is to stick with what we know with regards to using those foundational principles. We're continuing to use motivational interviewing by really having a conversation with people and asking those open-ended questions, eliciting that change talk to get them to, think about how it would be to be in housing they need to take, and maybe through that process realize what barriers they have or what assistance they might need, and really continue to affirm them. This is a very stressful time. I want to be sure to, as much as possible, uplift their spirit so that they can be motivated to search for housing, as despite the barriers that they may find in this crisis. Continue to practice trauma-informed care, allowing them the ability to choose, to have a sense of choice, and as much as possible, create that space for them to feel safe. active empathetic listening. These are things that we really cannot forget about. Oftentimes in crisis, you can skip a few steps and you're just quickly trying to move to the end goal without paying attention to some of those middle steps that really need to happen. And so we're stressing the importance of using these key principles. Oftentimes too, when we are rushing, we may go back to making quick decisions, and in that process could be the opportunity for bias, for inequitable treatment to happen, to occur. And so we want to make sure that we are moving at a quick pace, but not rushing and steps. And this really isn't just for case managers. This is also for leadership, to be able to support staff, to be able to have the capacity to do this detailed work, and think through how they will be able to accomplish these steps, whether that's through a new form with a checklist, whatever it is, so that we're making sure that we're not rushing the process. Also, we don't want people to have an insecure housing plan. We don't want to just set people up for failure or move them into housing without the proper support in place. And so being able to use these foundational principles will allow for a deeper conversation to happen, where we can understand what that person's needs are, what their wishes are, and it really help them to create their own plan so that we are not trying to solve for them. On the next slide. Through this, we're also highlighting strengths. So having them to think of things they have going for themselves. Oftentimes, homelessness can be people can feel very defeated and not realize that they have a number of things going for themselves. And if they realize the value and the resources that they actually do have, they may be more motivated to go out and do certain things and accomplish the goals that for themselves. So as providers, we want to make sure that we are being strengthened, having them to think, helping them to think about times that they've helped other people, people that are in their lives that could be of resource to them, just helping them to feel very independent, so that they can go out and not maintain, but maintain permanent housing. Next slide is a little acronym that I created called HOUSE, and is to help be client-driven and housing-focused. So the H stands for help, which is to support the person in developing their own housing plan. Ownership, when people feel ownership over their plan, they are more likely to complete it and follow through with it. Understanding no one is perfect, we all make mistakes, but allow that person the space in the room to be able to try so that they can learn from their mistakes. Share helpful resources, but don't just give the list. We want to make sure that we help them to navigate accessing them. Do they know how to take the bus? Do they know how to get to the places that they need to get to the home? Thinking through those things. Engage. So at every chance you want to engage this person. If they're in a hotel, if they're in a shelter, whatever their current situation, or unsheltered, we want to constantly engage them in creating their housing plan, not in a way that's pushy, but continuing to have this conversation, see what they might need to get them to that next step. And on the next slide, be sure to add tips, health supports to this housing plan. What type of additional needs does COVID present? We want to be thinking about those things. Does this person have access to food? Do they have childcare, especially during this time where schools are closed? Also, they are employed. Many of those that we are working with may work in essential jobs where they have to go in and do not have childcare. So how can we help them to connect to natural supports that they have, so that they can be sure to continue this? Also testing, what testing is available, helping that person to understand what to do if they start experiencing symptoms when they're in our care anymore. Where could they go? Who should they call? Are they connected to a PCP? These are we want to be sure to be thinking of when we're creating a housing plan, so that this person can sustain in housing after they leave the shelter or the hotel. And again, we want to give warm handoffs and help the person to navigate accessing the resources so that they're more likely to take advantage of those resources. On the next slide, I just list some housing possibilities. We want to be as creative as possible. There isn't a one-trick solution. Some people may be able to obtain their own housing and sustain on their own, but some people may have resources and will prefer or even prefer to stay with family or friends, natural or any other natural supports. Also, sober living home. So this time of crisis may be the turning point for that person where they wanted to take advantage of sober living resources. And so what can we do to that person in their journey towards sobriety, even during this time? Think of temporary leases. You know, in Connecticut, we have an eviction stay, and so landlords may be a little weary to rent to a person, considering this the uncertainty of the time, but maybe have a conversation with that landlord about a temporary lease, maybe a short-term lease, month to month. And so again, we want to get as creative as possible. Maybe this person has family out of town and we can support that person to relocate out of town. Of course, we're doing our due diligence to make sure we're not sending a person into another homeless situation, following up with that family or friend that they would be staying with out of state or out of town, to ensure that this is a permanent solution. But that could be a potential solution. And also shared housing. You know, if they have a person that they are currently in contact with that person has income and they have a little bit of income, shared housing might be an option, of course, as long as they have those separate leases. You know, that may be a very real possibility. In Connecticut, we are being very creative with the landlord engagement aspect of it, working with landlord associations, realtors associations, and also building the capacity within each of our 7 regions to connect to landlords, understanding who knows who. Are there any landlords who are statewide and have properties all over that you know, other providers can connect to? So again, just really getting creative. Okay, so I'm going to finish up very quickly with some of CCEH's emergency assistance. So we were awarded the Youth Homelessness Demonstration Project grant from the federal government. So we are working to help people get out of shelter or prevent them from entering shelter. We have shelter diversion funds through the Bezos grant that we got, and also our Connecticut Department of Housing match. Also, we have rapid exit funds through that. And recently, we just started our Connecticut Department program, which includes rapid rehousing and diversion. So we are really working all over across all populations and with all of our providers to really ensure that they have the support that they need to move people into permanent housing. On the next 2 slides, I'll just be talking about service provision very closely. We want to be paying attention to safety protocols, so limiting person-to-person contact, thinking about how you can do things virtually, in-person appointments, if you do have to do that, really when it's necessary, and taking those safety precautions if you do have to meet with somebody in person. On the next slide, these are some we have been sharing with providers on how to be safe if you have to go into the community, meeting outside, keeping the windows open if you have to meet inside, trying to stay 6 feet away, having hand sanitizers. A number of organizations have been providing cloth masks, and so sharing those with providers, making sure that they have access to them and can share them with the clients that they're working with so that they can be as safe as possible. And on the next slide, these are some resources that we have been sharing with providers on how to go virtual. So free apps and websites that they can go to scan documents. We've been doing all inspections in our diversion appointments virtually, and so we've been really using these. And also referring different types of resources to landlords. So RentMe, Rently, those are 2 different types of landlord management softwares that would allow the person to do showings, and so that we can so that we don't, or the client doesn't have to go in person. And also obviously we have been communicating more now than ever on statewide meetings with shelter directors, rapid rehousing providers, and using things like Google Hangouts, Skype, free conference calls. So we just want to share that with you all because that is really working. And if you all have any questions, you can reach out to me through My email, training@cceh.org. Thank you so much, and thank you, Mindy, for this opportunity.
Thank you, Mia. So glad to have you on. And Connecticut Coalition, always leaders across the country and just innovating and getting stuff done. And by stuff, I mean another word that I can't say on a webinar. But thank you so much for being here. I'll ask you to go ahead and stop your video. And then Jennifer and Jamie from Strategies to End Homelessness in Cincinnati, we'll ask you two to start your videos, and I'll go ahead and start your presentation.
All right, great. Hi, everybody. Good afternoon. So my name is Jamie Hummer. I'm the program director at Strategies to End Homelessness, and I have with me.
I'm Jennifer Steigerwald, the coordinated entry specialist, also at Strategies.
So Strategies to End Homelessness, we're the lead COC agency in Hamilton County, and yeah, so at Strategies, our mission is to lead a coordinated community effort to end homelessness in Greater Cincinnati. We always like to slide this picture into presentations that we do, as we're very proud of it. If before all of this, in the past few years, if you had the chance to visit Cincinnati and walked around downtown at all, you may have actually seen this beautiful mural on the side of one of our partners' buildings. Essentially, it's an accurate visual representation of what our homeless population looks like in Cincinnati by age, by race, gender, and family composition. And if you reflect on your own community, it probably would be, I'm assuming it would probably be pretty similar across the nation. You can go to the next slide. Actually, you can keep on going. All right, so Cincinnati had a very proactive response to the COVID crisis. As early as mid-March, we had moved all of our families that were living in congregate settings, which were about 50 families with minor children, into individual hotel rooms. Early on, we had also emptied our single women's congregate shelter and moved everyone into hotels, plus our outreach teams and staff at the two largest single men's shelters helped identify those with the highest risk of contracting the virus and moved the most vulnerable into hotels as well, where they've been ever since. Through all this, we have maintained our normal capacity of our shelters and are continuing to bring new people into the shelter or hotel rooms as people are moving out. So we're really proud to say that we've actually, that we've maintained our capacity, even though we have everybody pretty well self-isolated. Additionally, through working with our city and our local homeless coalition, we set up a quarantine facility in a downtown recreation center for people who are experiencing homelessness to stay while they're awaiting testing results. And then there is a separate floor set up in that facility for if anyone ends up testing positive. I will say, as of today, and we actually haven't had any positive cases in our shelters or outreach as of right now in our city, in our area. So that's really good news, and I think it was really a testament to just the being proactive and decisive in making those moves. And finally, we added one of our early response efforts was we added basic screening questions to our front door of our system, which is called CAP, or the Central Access Point. This is a phone-based service that anyone looking for shelter can call to check for space and be placed in a bed anywhere across the city. CAP's actually been in existence for over a decade, so we were lucky to already be positioned pretty well to adapt our front door to the community needs during the pandemic. Next slide. And then continuing in early April, we, after the initial wave of early changes, we made a few additional changes to our policies, like allowing over the phone coordinated entry assessments, which previously weren't allowed, as well as adopting all of the HUD waivers that were allowable in our programs. And then the main change that we're actually mainly here to speak on to you guys today is on our coordinated entry prioritization policy that we've been using since mid-April. Next slide.
Okay, so like Jamie previously mentioned, we implemented a COVID-19 prioritization policy for coordinated entry so that we can prioritize the people experiencing homelessness that have been identified as highest risk for developing serious health complications due to COVID-19. So this is the list of priority factors that we are taking into account. They are based on CDC guidelines. Highlighted in purple are two slight changes that our community decided to make because we wanted to take into account the additional vulnerability that people experiencing homelessness have. So we lowered or we added breastfeeding women in addition to pregnant women, and then we also lowered the age from 65 to 55. So in addition to those two things, we're also looking at some pre-existing health conditions. So those could be chronic lung disease or moderate to severe asthma, serious heart conditions, which are defined as heart conditions that are expected to be of long continued and indefinite duration and significantly inhibits the ability of the individual to live independently. Also, any conditions that can cause a person to be immunocompromised. For example, people undergoing cancer treatment, bone marrow or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune weakening medications. Severe obesity, which is defined as a BMI of 40 or higher, diabetes, chronic kidney disease, and those who are currently undergoing dialysis, and then liver disease. Next slide. So this is the procedure that we're using to prioritize the individuals who meet the criteria on the prior slide. So the first step is case managers at both shelter and street outreach notify coordinated entry staff of any of their clients who meet that criteria. And they also have to list how many of the criteria that they meet. For verification, third-party verification of the priority factors is preferred. But if clients cannot obtain third-party verification for whatever reason, self-certification is also accepted because we don't want to hold up housing for clients just because of that, because they're unable to get documentation. So from there, the coordinated entry staff will maintain a list of eligible clients who have the priority factors. And then once we have the list of clients with priority factors, all of our housing matches will be made using the appropriate standing prioritization policy, depending on which housing intervention has the available opening. So depending on if it's permanent supportive housing, rapid housing, transitional housing, or RHTH. And the last thing we have is that clients with multiple priority factors will be prioritized before clients with fewer priority factors. We don't prioritize any specific medical condition over another. It's just that if someone meets multiple of those factors, they'll be prioritized over someone with just one. So like, for example, someone who is 60 years old and has diabetes would be prioritized over someone who's just 60 years old and doesn't have any of the medical conditions. Next slide. We also have two exceptions to that policy. So the first one is that chronically homeless clients who have all required documentation will still be prioritized first for all permanent supportive housing openings. And then directly after that would be individuals who have the COVID-19 priority factors. And then our other exception would be that the highest lethality score will be prioritized first for DV housing openings, again, followed by COVID-19 priority factors due to the urgency of their safety needs. Next slide. So these are our standing PSH and rapid rehousing prioritization policies. So first on the left, we have PSH. So first, as I mentioned, is documented chronically homeless clients with the most severe service needs. And most severe service needs is defined in our community as the highest VI SPAT score, and then when it's applicable, input from our community's review panel. Right after chronically homeless clients, we go to the COVID-19 priority factors. From there, it's dedicated plus categories, followed by disabilities, longest periods of episodic homelessness, non-chronically homeless clients with the most severe service needs, again by the ISPDAT score, followed by disability without severe service needs, and then the final one is disability coming from a transitional housing program. And then over on the right side is our rapid rehousing prioritization policy. So the first thing we have is the COVID-19 priority factors. From there, we take the full the ISPDAT score range for rapid rehousing, which in our community for singles and youth is 4 through 10, and then for families, the score is 4 through 11. So we take that full range, and then the first priority goes to people who have the longest length of time homeless in their current episode of homelessness. And then to break ties from there, we go to highest ISPDAT score, still within that range. After that is no or lowest income, and then finally prior rapid rehousing utilization. Next slide.
Oh, that's me. Unmute. Okay. So yeah, so I think it's important during these times that we, we're really focused on the crisis response, which is obviously the highest priority in order to keep our folks safe. But almost as important is lifting our heads up once in a while to see the absolute highs that we're actually seeing as a direct result of this pandemic. And how we can use this as a means to actually move the needle like we really maybe never imagined we could, at least in this short amount of time. So I really wanted to end kind of on a positive note, and just a way to like kind of lift our heads up. The way most funders are loosening restrictions on funding in order for us or our teams to get the work done is really allowing us to think more creatively and with kind of a renewed sense that we can actually make a dent in this thing without an element, without the element of a COC competition looming over some of this new funding that we have. We can really try things that we think will work, but we've maybe been too cautious to pull the trigger on in the past. So like something for our community, Jen mentioned our prioritization procedures, and we are, as a community, we've been trying to move towards more of a progressive engagement, more individualized approach for every person. We've been really trying to move towards that model for the last year or two, but just things have always kind of gotten in the way. There's always been barriers. And there's been, a lot of folks that feel, a little bit nervous about making such a huge shift. But with these new dollars, this gives us the flexibility and the ability to really think creatively without that competition looming over us. So we can really try something new. And then another example we've seen locally is with our ESG waivers, the ESG waivers that are out, we're able to waive FMR requirements, which has always been kind of a high bar that locks us out of some areas and keeps us from accessing new landlords. But now we're meeting new landlords that we've never been able to talk to before and can start building relationships with them to bring them on board and, with the mission of really hoping to bring them into the fold for the long run. So, there's really great things that are coming out of this, and we just need to keep, focusing on that. But yeah, I think next slide, questions, so we can end there.
Great, thanks so much, y'all. And we'll hold the questions until the end when Becky from Strategies will also be joining. I will let you guys know from Strategies, there have been some questions in the Q&A box that are specific to y'all if y'all want to
Sure.
take some time and go in, or I can also pose those at the end. But some of them are very specific to your HMIS and your prioritization scheme.
Okay, we'll take a look. And do we just like click answer live and then that'll
if you type in the answer and hit send, everybody will be able to see it in the answered.
Okay.
So I'll ask you guys to go ahead and turn off your video and mute yourselves. And next up, we'll have Sarah Busick, who has turned on her camera and is unmuted. Welcome, Sarah. And we'll hear about how things are going in Boise, Idaho. Welcome, Sarah.
Thank you. Okay, can you hear me okay?
Yes.
Okay, so I'm not going to go too much into what our response plan is, just because I want to have enough time to talk about those creative solutions that we've come up with in terms of housing. But very similarly to Cincinnati and Connecticut, we initially moved a bunch of people from the shelters into a a hotel situation. What our system chose to do was have the families and some of those medically fragile folks go into that hotel. And then kind of from there is kind of where the idea sprouted. Well, gosh, we don't want to send these families and these medically fragile adults back to the hotel or back to the shelter when all of this is over. So what are we going to do? Next slide, please. So, you can see here this response plan for COVID-19 positive folks. So we had 2 hotels. We had one where we were just kind of putting those families and those medically fragile. Then we have another hotel that was going to specifically be for COVID positive folks. Similarly to Cincinnati, we have not had one single positive COVID case in our homeless service system. Those people that we know and that we're working with every day that are in the shelters and are utilizing the resources in the system, no positive cases there yet. So what that allowed us to do is to be a little bit more flexible in the timeline, and use some of those the hotel that was for positive folks, we're able to use some of those hotel rooms when our contract with the initial hotel ends, which is going to be on the 18th. So go ahead and go to the next slide, please. So really wanting to talk about our response plan. Number one, I think that the most important thing for our community is that our collaborative efforts with our community partners. Our Path Home is our COC, and we are a public-private partnership of over 40 organizations comprised of, those local government entities as well as private nonprofits. And what we really did was we came together, as a unit and said, what are we going to do? How are we going to address this? As we all know, there are a lot of dollars coming in, and there's, honestly, a lot of public awareness, and we wanted to capitalize on that, for lack of a better word, going onto social media and saying, yeah, we're all supposed to isolate at home. Think about people who don't have a home. What are they doing? So what that has allowed for us is just a lot of exposure media-wise, just bringing awareness to the fact that we're working toward getting these folks housed. So in terms of solutions and things that we have come up with, first, we have a rapid resolution funds that just pays, a first month's rent and deposit. So people who maybe were displaced due to COVID, who are just, first time into homelessness, and really all they need is a little bit of extra money to get back on their feet and get stabilized. We want to give that to as many people as possible. The city of Boise did contribute $100,000 to that fund, which is for our little community in Boise is pretty good. We're very happy with that. And then we have used some other funding to actually hire someone who is going to who's focusing specifically on utilizing that $100,000 or leveraging that $100,000 to get folks housed. This person does have a property management background, which is very helpful. I recommend every homeless services system, if you can find that right mix of, kind of social worker and property manager, oh my gosh, snag them up because they're very valuable. They've just shown us a lot in terms of how we can utilize the system and how we can, just leverage what we have and through that assist our clients with finding safe and stable housing. Second bullet point, we did adjust our prioritization queue to focus on hotel to home. So our current prioritization model, we do not use the VI spit out. We have our own prioritization model that we've been using, I want to say, for about 1.5 years now. So we're continuing to use that. And then everyone that was in that original hotel, we just made sure that they were in coordinated entry. Most of them were, aside from a couple of folks who just kind of missed getting in the door. So we got them into coordinated entry, and are working on getting them directed either to rapid rehousing. Here in Boise and Ada County, we only our rapid rehousing dollars go to families with households with children under the age of 18. So none of those rapid rehousing dollars at this time serve individuals who do not have children. And then we worked with our local housing authority because they hold our PSH vouchers, and worked with them to see if they could release enough vouchers even to get those folks in the hotel onto the program. And that's been going really well. It's been all sorts of exciting because I never get to house, or give housing opportunities to 10 families all at once. And, and we're able to do that right now. It's really amazing. Additional monies that we've gotten have also been used. We're in the process of hiring 2 additional rapid rehousing case managers to spend down those dollars that we're getting due to COVID. The next thing, we did secure damage fund grant dollars. We have been working on a damage fund for the past few years, or past couple of years, just looking at all the research in the other communities that are doing it and doing it successfully. So we finally got some of those damage fund grant dollars, and we're hoping that we can use that or leverage that to get new landlords, or landlords. We have a lot of private landlords who they'll come to us and they'll say, gosh, I really want to help, but I just, this is my personal property, and I can't take the financial hit if someone, doesn't pay rent. So I can't risk that. So this just gives us a little bit more flexibility to work with maybe some private landlords, or landlords that are maybe hesitant and have never worked with our programs before. And what research, the research that I've done in all the communities that are doing this, show that having the fund is more important typically, because typically you're not really paying out on the fund as much for folks who do cause damage. We also, like I said, we were really focusing on that social media outreach. We've been in the paper. I believe we've been on the news, and then we also access social media, and we're outreaching to landlords. We're saying, hey, this is what we're doing, and we're using this crisis to our advantage, and saying, hey, we have people ready to go. We have people ready to move in. And by the way, they kind of have a guarantee if they're in rapid rehousing, for sure, that their rent's going to be paid for a specific period of time. And that's been palatable, and people are reaching out to us saying that they want to contribute, and they want to help, and they want to, do whatever they can. We also outreached to our community, our faith community, our faith leaders in our community reached out to the greater community and essentially asked people that if they didn't need their stimulus checks, to donate them, to our system, whether they're going to the shelter or whether it's going to coordinated entry, whether it's going to rapid rehousing, just encouraging people, think about what home means to you. And then if you don't need that stimulus check, think about donating that. That's kind of that next bullet point of the creative solutions that involve community members who want to help. Really anything that anyone wants to do, right? We have boxes of masks, that little old ladies are making for us. And, we're putting that on social media. And what that does is it fuels that desire to help and do something a little bit more. I'm very aware that we're in a smaller community, and that we're in a very, I want to say, tight-knit community. So, when there's a need, the community typically responds. I also want to say, due to our public-private partnership and all of those partner networks that we have, that has also really just been indispensable in getting the word out and accessing those folks who may have a higher reach, or on higher totem poles than I am, for sure, as the coordinated entry director, to get money and to get landlords. That's really what we need. And then all of our ESG dollars at this point have been prioritized for prevention and rapid rehousing. There hasn't been a whole lot going on with prevention just yet. We're all kind of guessing that that's going to fall out later, but they're definitely gearing up and getting ready for that. So when we had everybody in the hotel, and we're thinking about what we're going to do, we decide hey, we're going to try and house as many people as we can in 30 days, you know. And so, like I mentioned, we got them all on program. All of the rapid rehousing families that are in the hotel have been put on program. So we're working with them actively right now to remove some of those barriers that they have to housing and get them in. And then with our PSH folks, excuse me, as many of you probably know, that application process is a lot more, it's just there's a lot going on there. So it takes a little bit more time, but we are getting those folks on program as well, and meeting with our folks, our case managers, and really including them in the process, because we can't do this without everyone really buying into, come on guys, we're going to do this. We're going to do this in 30 days. We want to house as many people as possible. So the current goal right now is to house as many people as we can by the 18th out of that original group of folks, or in that original hotel. And those that were unable to help find housing by the 18th, they are going to move to the other hotel that we have reserved for positive folks. And we will continue working with them there to get them housed. And I think that's it. I don't think I have another slide.
Yes, that's it. Thank you so much, Sarah. Now we'll get to our Q&A, and we have lots of great questions coming in. I'll ask everyone to turn their videos back on and to unmute themselves. And Becky DeBelt will also be joining us for the Q&A. And actually, we're really glad to have Becky on here. A lot of you have been asking landlord questions and housing questions. So I'm going to pose a general landlord and housing question to everybody. But because Becky is, like Sarah talked about, someone with property management background, landlord engagement experience. Let me see if I can get your video turned on, Becky. We're gonna go ahead and start with you. There she is. Welcome. Okay, everybody's back on. I see all your beautiful faces. And let's get this thing started with a question that Becky will start us off on. Tell us about landlord engagement in this environment. I think for a lot of communities, it's what we already know how to do really well. And then where are the tweaks that have to happen during the coronavirus? And then I'm gonna pitch it to the rest of you too, to just kind of talk about in your communities some lessons that you're learning about landlord engagement during coronavirus. So go ahead, Becky.
So I've met quite a few new landlords recently in the past couple months since this has started, because the program that I work specifically does require the FMR. And now that we have that waiver in place, I've kind of been introduced to a new pool of landlords that have units that are rent reasonable. A lot of them work with our local housing authority here. So that's been nice. I've met a lot of them online just doing research as well. One kind of new tweak that I've been working with now is going out, doing inspections, having clients go look at units, but doing it while keeping distance. So, you know, we'll utilize lock boxes or meet outside and then people go in one at a time. Trying to think. Other than that, I've had, you know, some landlords that would give me client keys, and then I would go meet the client there, walk through, let the client walk through on their own, and you know, we're able to do it and keep our distance at the same time. Anything else, like more specific?
Becky,
Oh,
you've
sorry,
been.
I was muted.
Oh, thank you,
I'm sorry
about that. Mia, tell us a little bit more. You had that great slide on some stuff that's new in the virtual world with landlord engagement. Can you go over some of that again?
Yeah, absolutely. It's been helpful to, someone asked about how we were getting new landlords. And so we have been using, in Connecticut, we have the Connecticut Realtors Association, which I believe is one of the largest in our state. And so they are well connected. Building that relationship with them. First, it was through our shelter diversion fund, but we've maintained that relationship to expand. Working with landlord associations, we have several in Connecticut, throughout the state. And so doing that to be able to connect landlords and property managers to providers working in those specific regions. And then also, once you do get in contact with the person, if they do, with the landlord, if they have concerns about someone's income and just any type of instability during COVID, you can get really creative with, with the lease on maybe like an addendum where they just have a short-term lease, and after a certain amount of time, they can sign a full 12-month lease, do a month-to-month if necessary. If you have the capacity to stay with the person, like do any follow-up with the person after they leave shelter, you can be of resource to that landlord. So, having a way that the landlord can contact you or your agency should they have any questions. And then that allows you to maintain that relationship with them long-term, just like you have, of course, more people that you need to house. And then lastly, just using the different apps, software so that you can tour, So those have been really helpful.
Thanks, Mia. You were going in and out on that last one. So let
Sorry.
me clarify. No, it's okay. So that app for touring, it's not the same as what you might use for doing the inspections, right? That would be something different.
No, for inspections, we have been sometimes using FaceTime. So once the landlord is at the location, they can, and the case manager will request them to show certain parts. So ask them to flush the toilet, ask them to lift the windows, and all the things that they would check normally in person, they're having the person show those things. And then later on, if they need to follow up with pictures or anything else like that, they can do that at a later time, but really using video to do that, or just having the landlord unlock the space, and then the case manager can go when no one's there and do their inspection. So that's two different ways.
Great, thank you. Sarah, any additional thoughts on landlord engagement, aside from some of the stuff you just brought up, and also now that we're talking about just for doing inspections and having things either be virtual or very socially distanced?
We are here in Idaho. We are favoring the social distance approach. I believe some of the inspections are going virtually, but I know, like, I've been doing inspections. I've just been going and masking up. But in terms of landlord engagement, it's really just that, our partnership network, they've been, like I said, indispensable in connecting us with folks. And that social media presence, and then the general media presence has been really helpful.
Great, thank you. Okay, so this will be a tough question for everybody, but this is serious, and I do want to pose it to all of you. Mia, this will be a little bit different in Connecticut, but I know in Cincinnati, Jamie and Jennifer, you talked about not having any positive cases in shelter. Sarah, I think also there you weren't having any positive cases, but we do know that in some places, for example, the person who posed the question talked about Boston, New York City, LA. We have a lot of positive cases among people experiencing homelessness. So can you talk about addressing, there's always a stigma when working with landlords for people who have experienced homelessness generally, but now there's this potential additional stigma that needs to be addressed. So Jamie, Jennifer, or Becky, one of y'all want to start on that?
Yeah, I don't know if Becky, if you've come across this specifically with any of your the people you've been trying to house recently, but I know that we've definitely heard, landlords that have units that are available and could be rented out today, but they're holding them or not specifically renting. Maybe they're not saying it specifically out loud, but they're not renting to people coming out of homeless shelters because of the stigma. But I think we just, we've been working, I know we need to just communicate with our landlords that we do have a relationship with already, and just communicate the fact that, the way to solving this crisis is housing. Like, somebody can't stay safe, and like somebody mentioned earlier, you know, we can't, like, you can't self-isolate or stay at home without a home. And so this is the way to make sure that not only this person who we're trying to house, but also the community stays safer and stays healthy. And just, you know, like reiterating that to landlords, I think has helped a bit. I know our largest referee housing provider kind of held off on referrals on taking new clients for a while because they were really running up on that. But they've since opened up their, opened up more openings recently, and are have been able to engage landlords a bit, but just through education and communication with them.
Great, thank you. Sarah, how about for you guys in Boise, just dealing with the stigma of, even if you don't have officially positive cases, we know that many people are positive but asymptomatic, and that there's just a general panic. Anyway.
So we're not really experiencing that here, to be honest. Maybe, I think due to the political climate, due to the fact that we're less populated, we're not seeing things like, LA, Boston, or even, areas in Colorado. And as soon as all this went down, I have a connection with the legislative chair for NARPM, National Association of Rental Property Managers. I immediately contacted him and said, what are you guys doing? What are property managers doing? What's going on? And he said, by and large, it was, business as usual. They still need to rent those units. They still need to rent out that asset. And it's almost, it might even be beneficial for us because people need to get those units turned over quickly. He said at the most that they were just taking a little bit extra time to turn over the units and then doing virtual inspections when possible. But that just really hasn't been our experience. If they're going to have a stigma, it's going to be about the fact that they're experiencing homelessness, not that they're sick, honestly.
Right. Yeah, I think, and Mia, I'm going to give you this question too, but I want to just observe, I think it's been, I'm hearing from folks across the country and communities across the country, and this makes sense. We all kind of had a justified panic attack, right? When things were just happening, and it's a serious emergency, and it's deadly for people, especially for the people that we serve who already have so many pre-existing health conditions. But the skills that we already knew about how to get people housed, about how to overcome barriers to housing, those are the same skills we'll be using for people who are experiencing homelessness and have potentially been exposed to coronavirus. So it's just about using those same skills that we already knew how to use, and then where we need to tweak them. So Mia, in Connecticut, it's been a little bit different because you all have had more cases, and there have been cases in shelters. So do you want to just talk about, has it come up with landlords?
Yes, this has come up. We have been working very closely with our Department of Public Health on establishing health protocols. Recently, it was announced that there will be readily available testing for people who are in shelter. Notice that we can also use this as a tool when working with landlords to let them know about the frequent testing and how people maybe are a little bit more aware of what their current status are. But I don't think that we necessarily need to go into the details with that, because I definitely agree with Sarah, where at the end of the day, landlords are thinking about. And so just, pushing that.
You cut out there. Can you tell us that last part again?
Oh, say it again.
You cut out there. Can you tell us the last part again about agreeing with Sarah?
Oh, just agreeing with Sarah that landlord, just drops mic, agreeing with Sarah. No, but just agreeing with Sarah that landlords they're running a business. And so really just being able to push that message that in your space, paying rent, and that's better than a vacant one. So really using those bargaining tools and that persuasive kind of message where, at the end of the day, your unit is going to be filled, and that's better than it not being filled. You'll have some income coming in. And I think that is really what has been working on our end. And then with the positive case honestly, that concern for people, we just stay on message. We stay on message about, filling that unit.
Great, thank you. So I want to put another question to all of you, because every community has an influx of funding now, and we are super grateful for that. And I'm going to have an advocacy action for all of you to take, just a quick advocacy action after we finish the Q&A, to get even more funding for people who are experiencing homelessness or housing instability into our communities during the pandemic. But I have heard also from folks around the country that while this is a crisis, this is deadly for folks, this is also an opportunity. Jamie, you guys talked about using this as a time to make some change and permanent change in how we do things. Having enough funding to house everybody makes such a damn difference. And so can each of you kind of talk about maybe one thing that you've learned during coronavirus that you're going to carry forward and that's made a difference and really kind of is like, this is how we're going to end homelessness in our community? Jamie, you want to get started? You talked about a few of them in the presentation, but tell us some more about that.
Yeah, I think one thing that I'm just hoping that, continues forward is the flexibility that we are seeing from our funders, from our partners, like when all the bull gets taken out, and just is actually let go, we can actually get so much done. And with every, like a pandemic is happening around us, and we are still able to house people and still able to, provide housing for people who need it. And that, like, just being able to maintain that in this crazy world tells us how much we could do in whatever normal circumstances are. But yeah, and I think just maintaining that higher level of thinking, that creativity of like what we could do if we didn't have these restrictions on us, because we don't have them as much right now. And I think it's just really exciting to see our partners, their wheels turning on how we can do things differently, and be okay with taking higher and more risks, because we don't have the fear of failing.
Awesome, thank you. Sarah, how about for y'all in Boise?
Gosh, I would really echo that. I think, being able to work within a more flexible framework allows for creativity. And then what I'm hoping is that people see that creativity and they see that it's producing results. Hopefully our data shows that, right? When we are applying for funding again and competing, but what we want to do is we want to, the proof is in the pudding, and we'll show you the recipe. We want to take this time to be incredibly successful with what we're doing, so that we can turn around a year from now and say, look what we did during COVID. Look what we can do if, when there isn't COVID, and let's all do this together. I think one thing that it has done for our continuum is bring some of those partners closer together and bring some more people to the table who have the ability to maybe do things like the executive director of our housing authority here can, that the housing authority itself can it's so bureaucratic, right? And so things can move slowly, and it can be really difficult to affect change within that group. I think probably across the country. And I think that them coming to the table and contributing creative ideas and solutions, I think that speaks really loudly to other partners as well. And people are, people want to play with us, is kind of how we're looking at it. And we're allowing that, and we want that to continue to happen. So yeah.
That's awesome. I think one of the things that we have seen, organizations, especially like National Healthcare for the Homeless Council and other national partners, have been saying for years now, housing is healthcare. Reframing homelessness as a public health crisis. And I think that now people outside of our field can kind of go like, oh yeah, you're right. Housing is healthcare. This is a public health crisis, because there's this larger public health crisis layered on top of it. So Mia, what are you guys seeing new? And I mean, Connecticut Coalition, again, has always been a leader around the country on innovating, but how are things additionally innovating now with the pandemic?
I was just going to say that in terms of like the whole public health kind of focus. I think now it's easier to have that conversation.
Yeah.
People are talking about homelessness now. They're talking about race equity now, which relates to homelessness.
Right.
So much more now. So I think being able to continue that conversation with our legislators, with our senators. We actually recently had a webinar with they were talking about the issues as if they were the advocates. And so we were super excited about that and just continuing that on into the next legislative session and into, conversations. And then also just, again, working collaboratively. I think now more than ever, we have collaborated with public health, housing, social services. Everyone is really on board with having these conversations. And so I think it has really built a lot of momentum. Sadly, it took a crisis to get to this point, but really moving the momentum along and to talk about how solvable homeless is as an issue.
Yeah. That's great. One of the great leaders on homelessness at the state level is Nichelle Carver in Virginia, and some of you on the last webinar probably heard me say this. There's a real possibility with the great influx of funds there because, like I said earlier, we do know what to do about homelessness. We've just never had enough money to get it done, right? And with this influx of funding, there's a real possibility, it's not a pie in the sky thing anymore of ending unsheltered homelessness with this funding and with the know-how that we have. And the way that Nichelle put it was, we're going to make the biggest vat of lemonade out of these lemons, right? And I just love that. I think about it every day because I know all of you out in the field are really struggling, and this is a really hard time, but there is this silver lining and there is this possibility of really implementing fundamental change. So I wanted to ask this is more of a nuts and bolts funding kind of question. We've had lots of questions about the funding streams that you're using for things like damage funds. How are ESG funding, the new ESG funding being used in your communities? What's paying for your hotel motels? So Sarah, do you want to get us started just because I'm looking at you on the top of my little list here?
Yeah, so hotel motel is being paid for with indigent funds through the county, I believe, possibly contributed money from the city. So that's what's happening there. Our ESG funding is all being directed, like I was showing before, to prevention and rapid rehousing. We were just told, apply for whatever you want. And, I think the climate is just making it so that that's what they're focusing on. And what was the third question? I'm sorry.
The damage funds and
the
ESG.
Damage fund.
Yeah.
So the damage fund, the executive director for CATCH, for a rapid rehousing entity in Ada County, applied for a grant, and I unfortunately I don't know the details of it. I believe it was just a private grant. It's a small amount, like seed money, like 25 grand, I think. But again, like our research has shown that those funds go largely unused. And it's really just about having it there and being able to say like, hey, I have this. That's really increasing landlord participation. Yeah, unfortunately, sorry, I don't know exactly where that one's from. That's one that's one we were working on even before COVID hit. She may have written that prior to COVID even hitting, and we just got the award just recently.
Great, thank you. And Mia, what's ESG being used for in Connecticut? How do you fund damage funds, and how are you paying for the hotel motels?
Yep, so FEMA right now is being used, but we will be converting over to the funds. Right now, we are just in the process of making those decisions where we currently are.
Great. And what do you got? I mean, it might be different for each program, Mia, I'm not sure, or within each COC, within each CAN, but landlord mitigation funds, the damage mitigation funds?
There isn't a consistent landlord mitigation fund. No, that is statewide. Some programs may have that, but we do not have one that is statewide and accessible to all programs.
Okay, great. How about for team strategies? Tell me about ESG, hotel funding, damage funds.
So I'm not the expert on this at Strategies, but like Sarah, we are funding some of the hotels through the indigent care levy dollars, some city county, like human services funding, local dollars. Yeah, it's kind of a mixture. As well as the ESG and CARES funding is also mainly funding the hotels right now.
Great, thanks. And how do you guys in Cincinnati fund the damage funds or landlord mitigation funds?
Unfortunately, we don't have, we've actually never, that's something that we've really been trying to build up. We don't have one at the moment. We think we'll have it in at least in our YHDP project. It's something that we've requested an exception for. And we've been told we'll be getting that, but that's obviously just for youth right now.
Great, thank you. And I think Sarah, you talked about doing the research. I think it's true in communities that do have these risk mitigation funds that it's more about being able to say we have this fund. It's not that it gets used that much. It's just that being able to reassure landlords. I have had a request, Mia, to go back to the screen of ways to virtually engage. And so I'm gonna, if y'all will hang on just a second, let me zoom back through a whole bunch of slides. Let me see if I can figure out how to do this without blurring all of you. There we go. So Mia, folks want to know more about some of these, especially the ones for working with clients. And we had a question earlier that I will end up posing to all of you. What about clients who don't have smartphones?
Yes, I would recommend getting very creative. So if they do have access to a phone, these on the screen have been super helpful. So someone asked about like scanning documents. If they have an iPhone, or if you have an iPhone, to them through the notes section of your phone, Microsoft Genius Scan. Those are some that our providers have shared that are super helpful to them, and several others. The list was very long, so those have been helpful. If they don't have a phone at all, I would recommend getting very creative with drop-off locations. So like if shelter, you could slide things under, or if they're in a hotel or shelter, depending on where they are, you could slide things under the door and have them use gloves, fill something out, and then slide it back under the door, and that's contact free. For those who in our system are in rapid rehousing programs, things like when they needed to go do their rental calcs, they'll leave documentation in that person's trunk. So the person literally goes to the window, unlocks their car or their trunk, and you put paperwork in there or supplies, whatever you're dropping off, and then that person you can close the trunk and they can lock it and they can get it at another time. If you want to leave it at a certain place at their house and their mailbox, whatever, you can.
Oh, you cut out a little bit on that last part, Mia.
Oh, of course I did. I'm so sorry. I'm not sure what's going on.
We're going to blame it on the state of Connecticut.
Yes, do that.
It's all of Connecticut. It's all of the internet in Connecticut.
Oh, I think so.
Okay, so for folks in Cincinnati, maybe Becky, especially you, talk about doing this work virtually and ways to engage. I know you're engaging with landlords, but then maybe Jennifer and Jamie, if you guys want to talk about some ideas that case managers have come up about engaging with clients virtually.
Yeah, Becky, do you want to go first, just what you've been working on?
Yeah, sorry, I was muted. So, I mean, I've been utilizing video with a lot of clients. I've worked with some people that aren't comfortable going to look at an apartment, and, you know, I like people to see what they're signing up for. So I will go enter through a lockbox, take a video of the unit and share it with clients that way for now. I know we've been doing like some of our forms, our documents can be done, like they'll give verbal consent to them. I'll either share them with them by picture or, you know, read documents to them and get consents that way from them as well. Every case is a little different though, so
Yeah.
play it by ear.
Yeah, I mean, I think I don't really have a whole lot of else that hasn't already been said, but I just know that it's definitely been a challenge for our other case managers coming up, you know, with landlords that are, a lot of our landlords may be a little technologically challenged. And so even just like sending a video or receiving a video is a little bit too much for them. So definitely has been a challenge. But like, yeah, like Becky said, just doing, you know, doing what we can, communicating with the landlord, seeing what they can handle, what we can get back and forth, and the same with the client, and then just do it on a case-by-case basis. I think Becky, you also said something about just, I mean, you could always, like, if a client doesn't have a phone, they probably know somebody with a phone, you know, like they could always you know, borrow from a trusted friend, or like if they're staying with their, you know, for the program Becky's in, we are a diversion program, so folks are still kind of doubled up and like just on their last couch, so they're staying with somebody. Hopefully that person might have a phone, just kind of like accessing the networks that they still have available to them.
Great, thank you.
I had a lot of folks use the Genius scan that is on here, and I too have been using it, and it's great.
Which one? Oh, Genius Scan.
The Genius scan, yeah. I've had some clients.
I'm looking at all your little things you have on here now. I didn't know about some of these.
Yeah.
Awesome. Sarah, how about you? Any more tips on working virtually with clients and landlords?
Just being super creative and understanding and giving people a lot of grace. You know, this is not a fun time for a lot of people, and we understand that. And, you know, we have clients who don't care, and they want to get housing no matter what, and they'll do whatever they need to do. We have landlords who will show units, you know, no matter what. And then we have people, you know, a lot of clients are doing virtual tours on their computers. It's been very challenging if people do not have their own computer, because our libraries are also shut down. So people have really struggled. So we've tried to just create a place in our offices where people can, if they really need to. But that's really a last resort, case by case. We're not having clients come into the office unless absolutely necessary. For folks who don't have a phone at all, we do have our coordinated entry side of our building. So we're attached to rapid rehousing. So we've got rapid rehousing over here, coordinated entry over here. And so our coordinated entry office is open from 10 to 3 for people to walk in. We also have an outreach program, and all of our outreach workers have been working every day, just maintaining social distancing and being as careful as possible. So they'll go and pick up things, drop off, you know, same kind of creative grace, and that's really all we can do.
Great. One of our attendees has just said, Johanna Jackson from, I'm not sure where, but it says CAM Scanner, C-A-M Scanner is a good free app to use also. Okay, let me see. I want to, see if we had any questions that we didn't get to. Can you guys talk, everybody just talk a little bit more, especially Cincinnati folks. There were some questions to y'all, but I think Sarah, for you and Mia too, talking about prioritization and how prioritization has changed or hasn't changed, or how you're layering things on. just kind of the thought processes that went into that, and how this might change moving forward, you know, after we're post-pandemic, your thoughts about prioritization and making sure that the most vulnerable folks are getting into housing. Jamie, I'll start with you just because that was a big part of the presentation that you all did.
Yeah, sure. I think
Jennifer.
something that is just really important to remember is that like this is like you know, it's a crisis response, and it's something that we only expect to do for the interim while we're in this acute crisis. And then you know, so you know, that's one aspect. But I will say also, I think what we kind of knew, but what we're seeing is a lot of the people that that fit this slightly more narrow, you know, CDC guideline priority factors are already prioritized through our normal process, because they, you know, our normal process prioritizes folks with a, you know, with mental substance abuse, you know, all these things already. So a lot of this, it's not really new. It's just like kind of that added layer, and just looking at who has the most of these, you know, these compounding factors. And it's just kind of a way for us to pinpoint more easily, like who really is the most vulnerable. And so like just through that layering, instead of like looking at it as separate systems or separate lists, we are, yeah, just layering these factors on top of one another. I don't know, Jen, if you have anything else to add to how we're coming at it.
No, I think you covered it. This has really just given us a way to kind of like, from our like hundreds of people on our prioritization list, to really like focus in on the people who have the most, like Jamie said, compounding factors, which will, while this policy is temporary to address the COVID-19 crisis, a lot of those same people who meet those factors are prioritized in our normal prioritization process.
Great, thank you. Sarah, how about for y'all?
Yeah, so our prioritization process, we moved away from the VI SPDAT a little over a year ago, and we've had a new, or maybe a year and a half ago now. So our process already takes into account a lot of what the Cincinnati team is doing as part of their kind of their added layer, just, you know, in terms of age, number of, you know, and children under a certain age, and their length of time, their lifetime length of time. We also have them take basically how we kind of view it as, you know, as part of that is that length of time, part of that is severity of the service need. And so you've got those components, you know, age, disabling condition, children, various other things. And then you've got a we use the World Health Organization's quality of life assessment tool that clients will fill out as they're waiting for an appointment, or we'll do it over the phone with them currently. And that creates a composite score that we use to prioritize everyone. So with this COVID thing, all we really did was go to our executive committee for the COC and basically just say, hey, this is what we want to do. Do we have your approval? We want to get everyone in the hotel, you know, out of the hotel and into housing and not back into the shelter. And, you know, of course they said, of course, and that's what we've done. And so then we took all of those folks and we really are looking at kind of the low-hanging fruit of those folks right now, like who's got the fewest barriers, who can we get into housing like right now, just to get them going quickly, and so that we can focus on those folks with those more significant barriers.
Great, thank you. And Mia, before you respond, because I think you'll probably have something to add to what I'm about to say, we've had a few questions about thinking about prioritization and racial equity and coordinated entry and racial equity. And I know the Racial Equity Network has been working on this. We had a webinar about it last week also. So I do want to let folks know that it is a violation of the Fair Housing Act to directly target housing based on race. But many communities have come up with other prioritization factors that kind of serve as proxies about race due to historic and structural racism. So something like criminal history, other barriers to housing stability. And I just want to clarify for folks, HUD has never said that any particular assessment tool has to be used by communities. A lot of folks don't realize you can use whatever assessment mechanism and prioritization mechanism your community decides on, your COC decides on. It doesn't have to be any particular assessment tool. So you do have the freedom as a community to determine your own assessment and prioritization factors, as long as you're demonstrating that it's a fair process and that it makes the system and programs accessible to folks who are traditionally not been able to access those before we had coordinated entry processes. So Mia, I'll let you have the last word on this, and then we will move on to a quick advocacy ask.
Yes, so around prioritization, we are considering that people who are 62 and up are part of the high-risk population as it relates to COVID. But in general, and we are looking at, length of time homeless. We are in our matching meetings considering VI SPDAT and SPDAT scores for those who are using those OR code tools. We do utilize them. However, we're being very creative in how we talk about the people who are on our by name list, which is just a list of people who are in need of services by name. And so we are very creative in not necessarily trying to predict whether that person will succeed in housing based on their whatever criteria, their length of time, but we are considering those things. And so what other things have we seen in interactions with this person? Can we try and rapidly exit this person instead of giving them a rapid rehousing slot? And so one thing, as it relates to race equity, is that you can consider things like, okay, does this person have pre-existing health conditions? Because we know that people of color are more likely to have diabetes, hypertension, and other types of health conditions that make them more susceptible to COVID. So these are, and then age is another thing as well. So these are some considerations to have when you're having this conversation where, as you said, you can't just say, well, because this person is a person of color, they should be prioritized because that will go against fair housing. But you can think about how vulnerable this person might be because of their negative outcomes, health outcomes, as well as if they have a criminal record, which make them more vulnerable to experiencing homelessness, make them more vulnerable to COVID-19. And those are some things that we're having in our matching meetings in terms of the conversation around this is more vulnerable and should be prioritized for housing.
Thank you so much, Mia. And thank you to all of our panelists today. I appreciate you all taking time out during this emergency time. Thank you all for attending the webinar. We see you all out there and appreciate the great work that you're doing on behalf of folks who are so vulnerable to this pandemic and to other public health crises. And we'll continue to be there for you. Look for the recording and the slides to be sent out to all registrants within 24 hours of the webinar. And finally, before we close, just a real quick advocacy ask. As we talked about earlier, we've gotten a lot of funding already. We need more. And with all of this new funding, we really have the potential to end homelessness in our communities. So you can take just a minute, super easy, to contact your senators and representatives and ask them to fund more homelessness and housing funding in the next stimulus bill. Thanks, everybody.
Thank you, everyone.
Bye, everybody.